Fall is only a few weeks old, but the Center for Disease Control has already seen near record numbers of flu cases. All the cases are so-called swine flu or H1N1. Seasonal flu isn't showing up just yet. The CDC says 41 states have reported widespread influenza outbreaks, and there is a 37% increase in hospitalizations just from last week.
Well, as more information comes out about swine flu, many people are wondering how they can protect themselves against this disease. We are joined this evening by Dr. Debra Gore from Group Health. Thank you for being with us.
Absolutely.
So many questions about it.
Absolutely.
What are you getting asked? What's the most common?
A lot of different questions. One very common question is, if my child is sick, what should I be doing? Am I at risk for getting sick? Another question is, what do I do if my child is sick? Should I get the vaccine? When is the vaccine coming out? It's a whole range.
Whole gamut,
yes,
right?
Big range.
What's your opinion on the vaccine?
I think people, especially the people at higher risk, should be getting the vaccine. Those higher risk people include children under the age of 6 months, pregnant patients, patients who are elderly over the age of 65 who have some underlying health concerns, and also children ages around 6 months through 24 years. These are the recommended high risk groups right now.
You're going to get your kids vaccinated?
I think my kids had it already, so I think we've already been through that.
Okay, so that's a question. My son was sick all week, just finally went back to school today. And I was told by a nurse that he hadn't actually been seen and diagnosed as having swine flu or regular flu, that he should still get vaccinated. Do you still get the vaccine?
The reality is, because we don't really know how many of these vaccines we're going to get, my guess is someone like that probably will fall to a lower risk level, that there's going to be more demand. I don't know for sure, but there might be more demand than there is amount available. And so I think, at least at Group Health, our intent is to try to get the higher risk groups vaccinated first. And I would say, just as a professional, if someone has already had the symptoms, like my own children, I would probably save them for later.
Pretty miserable, isn't it?
It's a horrible, you feel horrible when you have
bad.
it.
Now, we report about it every single day, and we have been for months. Is it too much hype, do you think? Are people giving too much credence to swine flu?
I think that's a great question, and I get asked that question a lot. My own personal opinion has actually changed a little bit throughout the last few weeks. My feeling is that this is something that needs to be respected. I don't think... I'm not sure that it's too much hype, but I think we all need to take responsibility and educate ourselves. There's a lot of great resources out there on the CDC website. The Spokane Regional Health Department has good information. Group Health has good information. And we need to just learn about it so that we know what's going on, and that if you do exhibit symptoms that seem more severe, that you need to get yourself some medical attention.
Very good. And we have some links to some of those sites on ours at KXLY.com. Dr. Gore is going to hang out with us. She's going to be back at 6 o'clock. Please email us your questions. You can do so right now. Go to news4@KXLY.com, and then we will ask her some of your questions during the 6 o'clock news. Dave, Chris?